Biochemistry practical test for magnetic test heat forward taking test. The magnetic test chemical test used to check for presence in reducing sugar in chewing analytic. There was sample carbohydrate content free glucose aldehyde functional group of reactive based on which test. The test magnetic test again pentahydride of 3,2-sulfate. Exposure reducing reaction undergoing magnetic reaction result in formation for brick red precipitation. Image details the change in polar magnetic reaction from clear blue brick red that are taken exposure reducing sugar in private blue. The magnetic lab reported outline magnetic test. Reducing sugar the Pluton aldehyde group that reducing copper to sulfur is in magnetic region to copper 1 oxide formation polarized precipitate. Objective to detect the present reducing sugar monosaccharide disaccharide sample. Material magnetic region to the water bath trap sugar sample, glucose sucrose urine sample and clinical tests. Noted the magnetic test also checks the presence of glucose in urine sample. The aldehyde beta hydroxyketone to glucose and aldose open the chain from the aldehyde group related to yellow phosphorus resulting glucose presence in the scanner. The presence of aspartic acid, homogenetic acid, other reducing substance urine. Therefore, positive magnetic test does not necessarily imply the test tube the between diabetic. Magnetic test implies reducing sugar in subject present in the alkyl and try to convert it into the Anatolian with same related powerful reducing sugar. Therefore, the reducing sugar in cupric ion and magnetic trigger to the reduce cuprous ions. There, cuprous ions to copper 1 acetate, which reaction mixture will precipitate out the pre-grade collide compound. Relation between the aldose magnetic reaction result in the formation cuprous acetate and provided above. Purpose of use to the test for presence in reduced sugar aldehyde group of carbohydrate natural tips of blue alkaline solution. The androus sodium carbonate and MC sodium citrate 173 gram, copper 2 sulfate bentonite 17.3 g, which is above the chemical from stable alkaline copper solution. Test for the magnetic reagent in test tube. So change the color kit in the reagent pool. A step-by-step reaction example that starts with the reaction step. Mix 1 ml sample glucose solution urine. Heat mixture in 2 minutes. Observe change. Balance reduction. Glucose sachet and red repeated. Interpreted result color range blue no sugar green track low orange moderate brick red high. After material 1 ml sample placed into the clinic test 2 ml trap penetrant 2SO4 placed in the test tube. Solution is heated in water bath 3-5 minutes. Solution to precipitation formation. Result in intermediate magnetic solution. In pan 1.5% is the sugar solution. Pan 2 to 1% of sugar present. 1 to 5 pan 1 to 1.5% of sugar present. 1.5 to 2.0% of sugar. Break red increment more than 2% sugar in present solution. Lab and experiment steps blue red no, green yellow PPT tracker reducing sugar, orange red PPT brick red large amount of reducing sugar. A password penetrates formation of reduced experiments reducing sugar present in sodium glucose. According to genetic test, no color change, remains blue, reducing sugar, absent example sucrose. Test for reducing sugar 1 milliliter for the analytic sample maximum is 2 milliliter. Genetic reagent heated water bath 3.5 minutes. The regretful cooper actually confirms the presence of reducing sugar analytic reducing genetic test. Green 0.2%, yellow 1%, orange 1.5%, red 2%. A genetic test for urine protein. The genetic test will regain the blue solution and maltose. The carboxyl anion pre-creative precipitation genetic reagent control sample the seeds observation. The step reaction. The step formation in anatolic reducing sugar gate alkyl anatolic strongest reducing cupric ion genetic reagent 0.0 ml track 0.3 mg plus 1 plus 0.5 to 1.0 mg double plus 1.0 to 1.5 3 plus 1.5 to 2.0 mg percentage 4 plus 1.0 is greater than the percent of the alcohol. Genetic test used to detect production sugar solution. Below the summary of the factor affecting the test and how to interpret the result. Factor affecting test plus pathway gradient trigger flash pathway result. Example include salicylate, penicillin, streptomycin, isoniazid, aminosalicylate acid. Concentration during higher concentration of creatine, urate, and aspartic acid can cause slight reduction potential shock. The tables follow the color of the solution indicated the observation concentration of sugar present. The blue dark blue 3 green no precipitate 0.5 gram track. Green with it precipitate 1.5 1.0 gram. Brown and clearly 1.0 1.5 gram. Orange and clearly 1.5 2.0 gram. Red and clearly 1.0 gram. Used Benedict solution. The Benedict test is chemically assessed to detect the presence of reducing sugar, glucose, fructose, and lactose. A clinical diagnosis will be used in lab and test glucose in urine with a primary indicator diagnosis and monitoring diabetes. Food science employed to identify simple sugars, beverage food products, and nutritional content. Education used the cool experimental to demonstration in derived reaction and basic biochemistry. Habit identification provided quickly way to identify by presence and the approximate quantity reducing sugar based on color change from blue to green, yellow, brick red. Heat coagulation test. Heat coagulation test. Heat coagulation test with heat and acetic acid test. Rabbit cause effective based diagnostic tool. Purpose data. The proteinuria specifically identification presence of albumin and urine. Mechanism process involving heat in the urine sample and adding the acetic acid. Reaction this action with gas protein denaturation and precipitation making the protein visible. The clinical examples of pathway result may indicate kidney damage, nephrotic symptoms pre-academic during the pregnancy. A clinical signification proteinuria screening used to detect abnormal protein level indicating potential glomerular damage. Pregnancy survey supports effective screening tool gastrointestinal proteinuria. Specific protein helping identify albumin and bench John's protein linked to the multiple myeloma. Bastard utilized identify settings of black automation due to simplicity and low cache. Producer and result. Bowling the head is attached to fill the urine to the bowl. Observation to be predicted presence in either protein and phosphate. Acetic acid addition added to different native between the two. Phosphate fluid and dissolving. Protein wholeness process confirms the coagulation protein. Interpretation the final result graded based on degree of tributative. So coagulation test prothrombin time where INR measure the extremely common that way. It is the primary used to do the monitor variant and therapy and assess the liver function. A activated protocol thromboplastin time measure the intrinsic and common that way. It is the commonly used to monitor hybrid therapy and screen for hemophilia. Thrombin time TT elaborate conservation with fibrinogen to fibrin. Fibrinogen level measure the amount of fibrinogen available in the clot formation. DMER indicated the presence in fibrin. Deactivation produced the option of use the screen for DIC or VTI. Bleeding time. Assess the platelet function and visual wall integrative. A clinical interpretation the result help in distinguish between the several conditions. P2 only early vitamin therapy vitamin K deficiency. APTT only hemophilia A bar B hybrid use or one vascular disease. PPT and PPT82 liver disease advantages were foreign therapy or DIC. Bleeding time, platelet dysfunction, aspirin use or VWD, abnormal within DIG, deimmunogenic intervascular coagulation, guaranteeable low platelet, low fibrinogen and high DMLT. The clinical significant difference in helping the clinical difference between the liver disease factor deficiency like hemophilia and affected anticoagulated medicine warfarin was hybrid. Assessment indicated the life therapeutic condition like TIG where rapid intervention would request. Heat coagulated test protein differentiation. The heat coagulated protein the biochemical test determines the presence of protein like albumin and globulin protein. Coagulation responsible heat is a common phenomenon. Heat of protein occurs into one of the two stages, denaturation and acculturation. The separation of denaturation protein is a particular form. The heat of coagulated protein is a isolated pH series of change occur the protein. These electrons submit to the material structure uncoiling polypeptide chain, ultimately leading to the mating together uncoiled polypeptide chain. Coagulation and flocculation are separately visibly manifested when change of that occur protein during the degeneration process. The process will measurement the isoelectric pH protein. The important clinical test is degeneration proteinuria. The lifetime consumed both of quality and quantity estimation of protein can be done with the heat coagulation method. Quantitative analysis of coagulation and perform the measurement coagulation coagulament format in the tube. The heat coagulation protein that detects the protein that in the sample detects the presence of albumin, globin and protein presence in the urine sample. The recruitment to gain chlorophyll and drug indicator 1% acetic acid sample material recruitment test tube standard prepared producer 1 hit coagulation test protein to the field that have given sample. 1-2 drop chlorophyll and drug indicator 1% acetic acid added. Increase slightly the short hits upper the protein the field observation information coagulation. The part 2 result is the hit coagulation test represented by the formation of different coagulation at the upper part of the solution. The lower part of the solution is tracked as a control. Negative result. The negative result of hit coagulation test represented by the option and the coagulum and the upper layer indicated the option albumin and the other protein urine. The coagulation test protein, the coagulation used to detect the presence in the albumin and the globulin protein in the urine sample. Albumin globulin urine is observation under the main pathology condition. Their presence can be convolution established by the test with the diagnosis is one of the most common method to detect protein in the urine. Limited set. With the case of it mainly result coagulation protein that might present in the urine. Improved the pH of the solution should be around the isoelectric pH of the protein substrated should be the sample. Heat coagulation test for urine protein. The urine analysis pH start. Normal pH at 4.58. More acidic 1.4.5. Neutral 7. More basic 8. More than level. Urine pH role on kidney length. The pH control role of kidney length. The pH, the blood and other fluid urine, the blood and other fluid urine to acid-base balance regulated by length of kidney. Acidic non-valeric acid, uric acid, extra valeric acid, potassium CO2. Regulated pH, pH to the alkaline, blood pH to acidic. Less than acidic urine, cigarette more than acidic urine. pH in acidosis alkalosis, respiratory metabolic acidosis, urine is acidic, not related to the renal dysfunction. Respiratory metabolic alkaline, urine and alkaline. The role in pH in role urine pH to control respiration of CHO3 from filtered in convoluted tubules. The urine classification of the basic of volume. Urine volume, anuria, oliguria, polyuria. The various color of the urine, colorless pale yellow, normal, dark yellow concentrated, green, phosphomedia infection, methylene blue. The yellow, green, yellow, brown, blue ribbon acidic to biliverdin, red, RPC hemoglobin and myoglobin, brown, black, methyloglobin, alkaline, urea. The urine pH region trip methyl red, brown, methylamine, blue. pH 5, bromine and blue, pH 9. Methyl red P plus H2 plus, bromine blue H plus. Red yellow, yellow blue. Yellow to blue. Origin of kidney disease. In the early 18th research made Hayes Hospital, Central London, found associated edema which associated with heat coagulated urine precipitate alternative kidney autopsy. Apparently good detecting greater than 2 plus on the diptych urine test. Pro to urine greater than 5 mgd, SN to 0.58 sp and 1.98 ppv, 0.97 pnb. Taper standard HCT. Apply the 5 ml urine into the test tube. Add the drop dilute acid. Heat the urine column without a bubble. Compare into cat. +1, +2, +3 first floor. +1 detecting turbidity observation printed letter the clearly throughput. +2 definition turbidity observed printed letters that cannot be read clearly through the tube. +3 definitive turbidity observed nothing the observed through the tube. +4 protein clad RC in the tube. The based on salt provided. The interpretive result of urine protein heat correlation. Negative track plus a definite coldness. Conceal the without the difficulty. +2 the definite coldness. The cannot read letters and only finally visibly. +3 definite coldness cannot read letters not even the faintly line deletion. +4 cloud present touch observers heat correlation flat.